Well, welcome everybody to the fourth Connexus webinar in the Aged Care Impact Series for Digital Health CRC. We are recording today's session, so if you don't want to be on camera, you don't have to be. If you do, fantastic. We love seeing your faces. I'm Sam. I'm the Comms Engagement and Events Manager here at Digital Health CRC. And for those of you that weren't at our previous webinars, you can find those on our DHCRC YouTube channel or on our brand spanking new Connexus webpage. And I'll pop the link in the chat shortly. Going to kick off with an acknowledgement of country. In the spirit of reconciliation, the Digital Health CRC acknowledges the traditional custodians of the country throughout Australia and their connections to land, sea and community. We pay our respects to their elders past, present, and extend that respect to all Aboriginal and Torres Strait Islanders peoples today. Just a quick bit of housekeeping. As I said, today is being recorded and you will get this recording by email in the next coming days. Monday should be sort of like the latest you'll get it. And we'll see how we go. Sometimes I get it out the same day. Pop all your questions in the chat and of course we'll cover them off at the end during the Q&A, and if you can, please keep yourself on mute to reduce any distractions and disruptions throughout the webinar. And obviously when we do open up Q&A and feedback, you are more than welcome to come off mute then. For now, I'm going to kick off and hand over to Megan Snewen, our Senior Program Manager and Aged Care Strategy Lead at the Digital Health CRC. And she's one of the driving forces behind this Connexus initiative. So going to hand over to you, Megan.
Hilarious. Thanks, Sam. Just taking control there of the slides. Thank you for that and opening it. Hello, everyone. Welcome back to our webinar series. I'm joined here today by a cast of thousands, colleagues at the Digital Health CRC, Annette Schmidi, our CEO, and Isabel Freen, who are both leading this initiative with me. We have our Beta Software development partner Jana Beda and Ilya Beda and Elena with us today. We've also got some contributors from our Interray colleagues at the University of Queensland and our technical advisor Tim Blake. So I can't believe we're here at our fourth webinar. I used to hate doing these, but I actually was looking forward to this one. So things are changing. Time is flying. And today we do have a packed agenda for you. We're going to be doing a quick recap, updating you on our mapping progress, development update for you, an exciting demonstration. We're going to talk you through how you can get involved in putting the user stories through their paces, and then just do a reminder of a call to action and a Q&A and wrap up at the end. Australia's aged care system stands at a critical juncture. The Royal Commission has called out data, transparency, consistent assessment and evidence base as measures of the care quality, and providers, consumers and government all want a system that is more connected and accountable, focused on person-centred care. So we're working at this together. And that is why, exactly why we're developing Connexus as a catalyst for this change. I know we've covered this slide a bit, but I think it is important to remind ourselves and do a quick recap. I'm often getting asked, what is Connexus and what is a policy demonstrator, which is a phrase we use quite a lot. I think while Connexus is a technical solution, it's a bit more than that. It's more of a collaborative journey to set the standard for aged care and empowering providers ultimately to improve the lives of older Australians. one of the most important parts about what we're trying to do here is, and something that we've stated all along as our key and main objective, is to influence the government to get them to bring about a mandate in standardising aged care assessment. But in order to do this, we appreciate that we will need to demonstrate the art of possible, which is Connexus for us, and Connexus being a policy demonstrator. So the slide focuses on the scope of Connexus, but I think in terms of a policy demonstrator, what we're looking for is something tangible, something that turns a concept and ambition into a practical production-ready solution. And so our main objective and what we're after is showing that via this demonstrator that reform can be operationalised and embedded into practice. We're hoping that by doing this and showing what Connexus can do, it will accelerate the understanding of what is possible, lower the barriers for adoption, and build confidence within the sector about real-world solutions with real-world users. So a bit about what we've been up to and where we've got to with our mapping. And so this work's been undertaken by our software partner, Beta Software, but we've had a lot of engagement with our colleagues at the AIHW, and we've been talking to the B2G team at the Commonwealth, at the government department, and we've also worked with our Inter-A colleagues at UQ to do all of this work. So thank you, everyone. But essentially where we're up to with the mapping is we've taken our first vendor clinical information system. We've mapped that through to AU Core. And then we've used FHIR to generate the Inter-A long-term care facility assessment, and then mapped that into the National Aged Care Mandatory Quality Indicator Program. So there has been work done adjusting some of the Inter-A items to be specific to Australia, and also identifying all of the Inter-A items which map to the minimum data set wherever possible. So there's some new items in the Inter-A long-term care facility Australian version being considered with respect to care leaver and stolen generation. I haven't had an opportunity to update this slide because this is new news with our Inter-A and UQ colleagues working with AIHW. So this mapping's all been complete now. It did give us, and what did it tell us? It did give us some specific aged care items, which is good, which we can feed back. But we have got this flow happening now, and Jana and the development team will tell you more about that later. So where were we up to? Another month down and another tranche of work. September has been busy. We've had a large amount of development work undertaken, and Jana will demo that for us. We've had a lot of interest in the last month with different vendors and providers, and we're looking forward to progressing lots of these conversations. If you are going to be at Ageing Australia, please come and seek out Isabel, Annette and I. In the last month, we've worked out the workflow and integration with the first of our vendors, which is great. We've also got the quality indicators being generated out of the assessment. We've got the workflow happening all the way through to the B2G portal and submission. And lots of other things Jana will tell you about. So let's look at some activities completed from a development perspective. I'll pass you over to Jana from our development team at Beta, and she and Lena will do a demonstration of work in progress. Over to you, Jana.
Yeah, great. Thanks, Megan, and hello, everyone. It's great to have this opportunity to show you how it works, and I'm trying to switch to next slide and just sorry. Here is the development activities that we have captured. So first focus of our interest was how do we improve the user experience for the inter long-term care facility assessment form, because the form is quite large, and we know that the population happens across multiple days, like it's not in the straightforward order. Sometimes you need to navigate over it. So we put lots of efforts in organizing the right navigation and giving the sense of progress, easy finding issues like possible missing items, and highlighting the outcomes of the assessment, like meaning that you can find the calculated scores, etc., and the form easily, and update the form as needed. So next important part of work was definitely the mapping that Megan already mentioned, and together with the Inter team, we did like two streams of work here. First of all, definitely a mapping to IU core. And based on these, we got the Australian-based version of long-term care facility assessment. And also we were able to leverage the public HL7 FHIR dataset, and we loaded it into the simulator, and now using while testing scenarios with KeyNexus application. Another important thing that happened that Inter long-term care facility assessment were aligned with current quality indicators data, and few non-Inter items added to the assessment form itself. And now it's easy to align, it's easy to calculate the quality indicators, and all the algorithms of calculations were developed by Inter team. We got great support on this. So now you will see how the calculations happen and how it's work in the reporting side. Obviously, we did good progress with documenting the overall system. We did technical documentation. We did like all user stories, and now they are public, so you can review and give your feedback. And maybe we missed something, we would be happy to to work with the feedback. And last piece of work that were happening in the background, this is work with first healthcare software vendor. We identified the architecture of the integration. We developed the user stories. We implemented the mapping of the data between the vendor API and the long-term care facility assessment. And now our focus is to basically implement this integration. And also there are a few things that we need to complete for the quality indicators reporting as well. So we have implemented the workflow of collecting data, statistic data, populating the report. Now we are tackling the part with submission data to B2G portal via APIs, and receiving the status of the report in the automatic way. I think it's a high level. This is where we are at the moment. And now let's proceed with the demonstration. I'll start with sharing my screen and showing you how the quality indicator reporting works. So I'll explain how the data flows across multiple systems to produce this quality indicator report. So everything starts within the HCare software. Basically, some data is captured in the HCare software. It happens when residence is admitted, some demographic information is collected. It also happens during capturing important things like practitioner data, encounters happening, health history is recorded, and later on when ongoing changes recorded in the health record. And the last point here is like resident is discharged. All these events and all this information that are created in the HCare software then reflects to the entire long-term care facility assessment, like initial assessment, routine reassessment, and the discharge assessments that are happening in different times. So this is the basic how the like data is collected. And now with this data, with individual assessments, we can collect the statistics. So we are calculating the statistics across all residents, and it's happening in real time, and changes are applied on the fly. So we have the different, stakeholder users here. This is a like in Kinexus Smart and FHIR application, we have a clinician user. In the quality indicators reporting module, we have a clinical quality manager user. And what happens here? So the statistics across all the residents are aggregated and presented on the report screen. It's divided by the quality indicator, so you can easily see every metric of every indicator. And clinical quality manager can create the quality indicator report for selected quarter. And the data from the statistics will be pre-populated in the report. Obviously, there are some parts of the quality indicators that are missing in the long-term care facility assessment, such as workforce, for an instance, and these parts of the information should be entered manually to complete the report. Once it's done, you can click a button and send the quality indicator report via API to B2G portal. And in the B2G portal, the automated validation will happen, and you will receive the outcome. You will receive the status of the report over here. So these are main, flow, how it happens. And now I pass in my word to Elena, so she can show you how it happens in the system.
Okay. Okay. Let's start with residence list. So in the simulator, for the demonstration purposes, we imported residents age 60 and over from public EU core dataset. So let's open one of them and start Kinexus. There is no assessment for this patient yet, but let's create new. Here we can see how data is populated for a given name, family name, like sex, and birth date, Medicare number. So also here I wanted to mention that we updated UI for the forms. Now user can easily navigate using left side menu. Also we added more color indications. This blue one just means current open section. Gray sections means there were no changes yet. Green means it was all the required fields was completed, and there are some more like light green if there was some changes, but still need some updates, like to finish some required fields, and it can be circle can be red if there were any errors or missing required fields. Yeah. Also, there is a counter for each section. So when the form requires from user some time to finish, they can leave it as it is and come back later and see what sections still need their attention. So like this. And now I'm going to move to the next part, and I need to open Kinexus Smart App with another resident. Let's open Anika. Yes, let's start. So here is assessment form prepared beforehand, and I'm going to demonstrate some other updates we did. I forgot to complete. Let me complete this one. Okay, so when form is completed, we can open it. And on this page, we see all of these sections. Again, now all of them are green because I filled them beforehand, and you can navigate, choose different sections, and see the answers. Let's also, on the right side, we calculate some scores. At the moment, there is only one, but there will be more. And let's demonstrate how it can be updated. Like now it's 20. Let's amend the form. Edit. And do some changes. I hope I... Okay. Should be like this. And complete this form again. Open it. Yes, and the score was recalculated. And user can click on the score, and proper section will be opened, and they can review it. Yes, so now I'm going to start second part of the demonstration, and I'm going to show you Kinexus B2G reporting.
Elena, before you jump out of, maybe
Okay,
it's too late.
okay.
Oh,
No
yeah,
problem.
that'd be great. Charles has just asked if you can show how unplanned weight loss QI is collated. Do we have that available?
Let me clarify the algorithm here, so Elena can show you the question with the weight here in the form. So the weight loss is calculated like this. So we look at 3 consecutive quarters, and if over this period of time the loss is more than 5%, then it's significant weight loss. According to like we discussed this like how this can work, and the current consensus is like that. Let me remember where is this in which section we have this question.
I'm not sure.
I think we can also do this offline with Charles in a meeting this week directly. So let's keep going, and we can.
No, in the form. In the form, we have in the assessment form we have a question about the weight, right? And these calculations that I just mentioned, they are happening in the background when we collecting the statistics, and this is a part of calculations that we are doing. So you don't have to remember. The system will do it for you. Yes.
Thanks for that.
Correct.
Thanks, Jan.
Okay. Yes.
Elena, feel free to jump into the next phase.
Yep.
Okay, thank you. So this is Kinexus login page, and let's log in as administrator. And so on this page, we can see B2G quality indicator statistics and reports. Here is the data we calculated from completed assessments in the system for the chosen quarter. Let's change the quarter and see yes, there is some data for Q2, and I guess there is 0 for Q1. Yeah, so let's back to Q3, and we can create report for this statistic. Here we can see that a couple of sections have pre-populated data, like this one. And so this is data was populated from the statistic we just saw here. And as we calculate this data on the fly, let's change a couple of answers for our resident and see what happens. Let's go back, amend this assessment, edit, and I guess 11K. Yeah. And in one more section, skin conditions, let's choose another answer, and let's complete the form. So now I go back to the administrator and reload the page. So data is recalculated, and we can create report again. And here is updated data as well, like for this section. So let's open. If we finish this report, we will see it on the report tab, but I'm not going to do to finish it because it's quite a lot of answers. And let's move to the report I prepared beforehand. Let's open reports, and report can be reviewed by clicking on open, and all the sections are here, and can be edited, and we can send it to B2G. Let's click the button and submit. So here is send date is updated and the status is submitted at the moment. So this is, I guess, it for the demonstration. So, okay.
Thank you, Elena. Oh, I'll just try to take the control back. Just to get. Oh, Sam, have you got that control? Beautiful. Oh, thank you very much. Hopefully you found that exciting. I think the real beauty is that the clinicians will be able to see those quality indicators on the fly. We appreciate that. Not the whole assessment won't be able to be done in one go, but the assessment, the way that it's been configured, the questionnaire will be able to be iteratively completed with the quality indicators and the most important things being flagged on the fly. And then when it does get aggregated in the back end and showed to the clinical quality facilitator manager, I think it still gives the flexibility of being able to bounce back and forth between, having that ability to check the data before you submit it. And I think that's a hugely important thing that we've found from our users as well, working with Sarah at Regis, is there is a bit of back and forth to finesse that data, to get that data right. So Connexus is showing that true link back to the assessment, where you can make sure that data is correct, and then flowing in real time to the aggregated data for the purposes of reporting through to the B2G. And so, happy to take any comments, questions, and feedback at the end of the session. So appreciate you doing that and all the hard work that's gone into doing that demonstration, and seeing everything come to life has been great. And so part of what we're doing at Connexus is mapping out the different user stories that we've seen through our work under the ACDC project and with Regis and with the vendors that we are working with at the moment. So we've really focused on the perspectives of the clinician and the registered nurse, the aged care executive and or board, and the quality managers, who we generally see as the people that submit the reporting through the National Aged Care National Aged Care Mandatory Quality Indicator Program, and then obviously the department who are accepting that data. So we have created a what's called a Figma board. Oh, thank you, Sam. She's one step ahead of me. This is a public board, and we would like you to put the user stories through their paces. And what that actually means is, you know, do these resonate with you? Are they right? Are there missing steps? Are there gaps? Are there other additional user stories that you see and that have identified? There may be ones from a vendor perspective. We talked this week about a particular user story where we would look at mapping back what we've done into existing vendor assessments, because we understand that the inter-eye long-term care facility assessment is not the only assessment that will be done, and that there will be other operational assessments and other assessments that are done in vendor systems, which is a key differentiator. So we've added that onto the list of things to do. So yes, we would love for you to click the link and have a look around in there. It should be pretty easy to navigate and to add comments. So we're looking forward to getting your feedback on those. So we've updated you today on what we've done, and I think I'm going to end by sharing a lot about the benefits. And it was funny because Sam and I were having a bit of a debate today, and I had said to her, "Oh, it sounds as though I'm going to be ending on a bit of a soapbox," and she thought that was funny because she got the word confused with soap opera, which did make us laugh and show us our age gap there. But so I decided to stick with the benefits. And I think, you know, for me, I think standardising assessments is often misunderstood as a compliance burden. But I think we are missing the opportunity to see it as a growth. If we look at standardisation of assessments as an opportunity for growth, and what it will allow us to do is to have that consistency across the sector with fewer duplications and less confusion and smoother care transitions between settings. What it will allow us to do is to compare and benchmark, identify gaps, track improvements and demonstrate excellence. And we often are focused on the decline of a residence, but we should be celebrating the improvements. And only with standardised assessments we can do this sort of benchmarking and comparing. So by showcasing, you know, sector leadership and positioning yourself as a forward-thinking and centred organisations, providers can move beyond this regulatory stance and help spark innovation. We know, and we don't argue that we need regulation. We know that we need the quality indicator program as it is built now, but we also need an industry-focused benchmarking that works for the sector. So some of the benefits we've outlined on this slide. We have designed Connexus to generate the National Mandatory Quality Indicator the quality indicators. So it is generating those now with the opportunity to add in the other ones that aren't generated from the long-term care facility assessment. It's capturing that with standardised data all the way through the workflow. It's captured once data and reused many times for multiple purposes, care planning, quality improvement and government reporting, which is just huge and so good to see. The resident level insights are available for staff to deliver better care in real time. We appreciate that, you know, the UI UX is, you know, it's a look and feel. It's the start of something. It's not finished yet, but we were hugely excited to show you just the whole workflow. Then we've got the dashboards there that are giving the management executives and boards, you know, the visibility of quality at an individual level, at organisation level, and across different regional areas. So yeah, we're pretty happy with where we're at the moment. We can see a lot of benefits in this approach, and we hope you can too. So what else are we going to do today? Call to action, Sam. Running a little bit early, but that's always okay. So call to action, as I mentioned, we would love to see you share your user stories and or comment on our user stories. We would love to have your feedback on this initiative, what we're missing. If you would like to participate in testing this, email us at connexus@digitalhealthcrc.com. We also have a simulator which is up, which you can have a play around with, and on this page is a GitHub where you can find the details of that with a help me and a repository there. And then there's some other thought leadership and reports about the aged care data landscape and the feasibility of implementing a standardised approach to functional assessments in Australia on our website.
And all those links are in the chat for you.
Thank you. So I think I'm passing back to Sam, am I?
Yeah, thank you. I just want to say a big congratulations for getting to where you are now. It's been a pleasure to see this journey go from week 1 to week 4, and it's really great to sort of see that starting to form and come together. As we go through Q&A, if you do have any, just pop some questions in the chat or raise your hand. There were a few that came through which we have answered, but just for the recording and the people that are going to rewatch this, I might just go back over them while we get other questions through. So we had, which vendors are we using? So we've got LeeCare, Acredia, and along with another one, but we're still working on an NDA and getting that in place. So the 9 QIs that are used in the Inter-A LTCF are the pressure injuries, restrictive practices, unplanned weight loss, falls, major injury, medication management, ADLs, intercontinence care, and hospitalisation. So just noting that this obviously doesn't cross over with workforce, allied health and whatnot, but we do hope that hopefully it will eventually as a long-term plan via the APIs. And then as we went through the demo, there was a question about the unplanned weight loss. So the system itself will calculate that, which is incredible, and it's all part of the performance scales and all part of their system. And then, yes, they are collected in real time as well. And you can feed in the weight of the resident into the Connexus app, which is great, so you can start to see those changes. And then that was it for questions. So if anybody has anything else, please feel free to pop them in the chat or raise your hand.
Just to make a note, Sam, that I have clocked the note from Hasma, so we will be in touch. Maybe we can, I'll circle back offline and reach out and set up a meeting. So that's exciting. Thanks.
You. If there's no questions, we might close it off and call it a day.
Sam, just before you do that, could I just call out the beta team and just congratulate them and say what a great job you've been doing and what a pleasure it is to work with you. And, you know, we've got a little bit further to go, but making great progress.
Thank you. Really appreciate that.
Yes, thank you. And thanks for joining us, Carmen. It was really good to be able to show you what we've been working on. And you're the ultimate person that will get the data. So that's it's great to have you here.
No, thank you for having me. Exciting work.
Hamaz, you can come off mute if you like, if you've still got your question.
Thank you all. This was really interesting for us. So my question is about, because in the setup that we are in, some of our residents actually come from within the hospital. So they transition from the hospital into the residence. So my question is it possible to transfer data from other systems that is HL7 compatible? So they can send HL7 messages, not FHIR though. So that for the technical team, are you able to receive messages that contain medical history, allergies, alerts, and other things from other systems through another middleware that exists? So if we have another middleware that is able to share those this information with Kinexus, are you able to integrate that into the dataset? Thank you.
Yeah,
I think I can answer this question. So,
perfect.
Our primary API for the whole Kinexus project is FHIR and built on top of EU Core. Yeah. However, if you like support only HL7 v2, like we can help you with implementing conversion from HL7 v2 into FHIR, maybe creating some kind of facade, and it's kind of very well-known approach in the community, because we have to work with legacy system. It is what it is. And we don't have any plans to support HL7 v2 messages directly, like address them and Kinexus and so on. But through this facade, we can convert HL7 to FHIR and consume it as FHIR dates. Yeah, this kind of approach. But Megan, feel free to add more details if you would like.
No, I think you've absolutely covered that, and we can talk about some of those more detailed things offline. Isabel?
I was just going to say, I think it's a really interesting question that Hans is asking. It'd be interesting to understand the systems that you receive that data from, and we're talking the Kinexus applications focused specifically around clinical information systems in aged care, but we're well aware that there might be other primary care systems that align to AU Core and align to FHIR that also could be mapped to some of the LTCF items. Be really interested to see what system you're receiving from the acute care system. I understand you're a regional facility, so you're probably integrated. That would be a very interesting conversation to have. It's currently out of scope, but this is precisely why we're wanting to bring the user cases in, have the conversations, and explore, well, how else do we expand out the demonstrator to really prove the point about capture once and reuse many.
Thank you.
Absolutely.
Thank
Thanks,
you so much.
Isabel. Is there any other questions? I love a good awkward silence. So I'm going to show you the next slide, which is our next few webinars. So the next one is in October on the 23rd, 3:30 to 4:30 Sydney time. And obviously via Teams. All the details for registration are on the Connexus website, on the DHCRC Connexus website. So you can actually register for all of the remaining ones, October, November and December. They've all been locked in and we are ready to rock and roll with those. So feel free to register early and get those locked into your diary. If there's nothing else, I'm going to close off and say a big thank you to everyone who's come on today and joined the conversation. I hope you're feeling very inspired, and we will see you next month.
Thank you, and thanks Sam,
everyone.
and hope to see you at Ageing Australia if you're there.
Thanks, Sam. Thanks,
Sarah.
Megan. Thanks, Jana.
Bye.
Bye.
Bye bye.